I am originally from Dayton, Ohio, and I started my nursing journey at Sinclair and got my associate's degree there. And a few years later, I moved on and got my bachelor's from Ohio University. And then I graduated several years later from Walden University with my master's as a family nurse practitioner. So originally I was a nurse on advanced care unit at Miami Valley Hospital, and then I moved on to medical intensive care, which I loved. It was great. And then a opportunity opened in labor and delivery, and so I worked there for about 6 years before I became a nurse practitioner. I really enjoy taking care of women, as I'm a woman myself, and a lot of the things that I take care of women for, I've been through myself. So I've had a vaginal delivery, I've had a C-section, I've had postpartum hemorrhage, spinal headache. I've had a lot of the things that I treat women for, including postpartum depression, which I'm pretty passionate about. And so I like to educate women and take care of women and show them, what's normal and what's not, and educate them about their bodies and the way they work and all of that. Our practice is very unique because we have a philosophy that birth is very natural and we trust women's bodies to do what they were designed to do. We utilize midwives, so it's a different approach than a lot of practices are able to provide. And the other thing about our practice that I love and that I kind of picked up on even in labor and delivery is that everybody kind of shares the same philosophy. So no matter which practitioner, midwife, physician you see in our practice, you're going to receive the same care. And so I think that that's nice that patients know what to count on. My philosophy of care is, again, that women's bodies are miraculous and wonderful and do a lot of great things. And I like to educate women about that. And, even in pregnancies and things that are not along the normal path, I like to share the recommendations and explain why they exist and work with the patient to come up with their own individualized plan of care rather than just dictating everything. Our support staff is absolutely wonderful. They're very, very well educated. They can answer a lot of questions for patients, which helps, keep the flow rolling. Everybody works really well as a team. And kind of, again, everybody at this practice kind of shares the same philosophy, so it's easy for the staff to know what to expect or what to tell a patient to expect and keep the ball rolling. I think our providers are really good at explaining pathophysiology and educating women on what is normal, what's not, what the options are. As far as birth is concerned, we're one of the only practices that has midwife care for pregnant women. And it's just kind of more laid back, holistic type approach. And we, again, try to work with the patients to come up with an individual plan of care because labor and delivery and GYN care, pregnancy, it's all so gray. There's so many caveats along the way. I, along my career, have worked with some exceptional nurses. I've had some great managers along the way. I started at Premier as a PCT almost 16 years ago. And throughout the way, I've had wonderful coworkers and support staff that has kind of fostered me through. So I worked at Premier from, the bottom of the ladder and now up to my master's degree. And so Premier itself and all the staff that I've worked with along the way has been very influential in getting me to where I am now.